Some age-related maladies can lead to more serious problems down the line. The good news is they can be managed. Age is the main risk factor for atrial fibrillation. It's the most common arrhythmia affecting about 200,000 Canadians, with 70% of them people between the ages of 65 and 85. Untreated AFib can lead to stroke and heart failure. Dr. Chow, our cardiologist, what are the main risk factors?
Well, with atrial fibrillation, as you know, age is one of them. As we get older, when people get to 80 years old or above, 10% of our population will have atrial fibrillation. And also high blood pressure, alcohol, and also sleep apnea. Those are all common risk factors that we face.
And Dr. Wharton, you're an expert in treating obesity. How does that play into AFib?
Well, we know now a lot more that obesity is a major factor. And this has only been about the past 10, 15 years or so that we actually have a much clearer understanding of it. And in fact, what some people are doing is sending their patients with atrial fibrillation to a weight management clinic in the hopes that this will make a difference. It's probably the lifestyle factors that can make a real difference here, but we don't know all of the details yet.
I would imagine that a lot of the patients in your practice have AFib.
Absolutely, yeah. So it seems more now than ever. I was just saying that, with the onset of Apple Watches and things like that, people, have an abnormal rhythm. Sometimes they just press it and come on in and say, look, there's something going on here. It's unusual. What should we do?
And what should we do?
Well, for starters, being on the front line, it's important to make sure that that's what it is, right? So that's my job, is to see what else could be going on. So is there an abnormality of their thyroid? Is this really AFib? Is there some other possible cause for their palpitations? Are they having symptoms? Are they not? And how you manage it depends on how recently it happened, how recently it started.
Is sleep a factor?
Yeah, I think that there is a relationship between obstructive sleep apnea and AFib, but many people with AFib will also come in complaining about insomnia. And if it's chronic insomnia, then it should be treated.
Does it show up in your practice at all?
It does, but usually it's at the time of a procedure, whether it's a biopsy, whether it's a cystoscopy, whether it's a surgery itself, and then usually the question is, can you bridge? Do you have to stop? And these are the questions that come up all the time.
Qiming, so there's a handy-dandy app now where patients can monitor their own heart rhythms. I remember a time when it had to be a Holter, and the Holter had to be on, and you'd miss things. And I think you're wearing it on your wrist.
Well, as a cardiologist, I wear them all the time because I can actually check my patient's rhythm and also demonstrate to them how to use it. And maybe we can demonstrate it while we're here. And let me try it. So here, what we normally do is patients will actually have these devices, and there are actually more than one type. And what you can do is put your finger on the crown, and then on the back of the watch, it has electrodes, so it forms a circuit between your left arm and the right arm. And in that way, we actually can create what we call a lead one on our ECG, and you can record the rhythm. And now I'm on TV, but my heart rate is 75. Not too bad.
Not too bad at all. And normal rhythm?
Well, usually it's anywhere between 50 to 100. And especially for people who are more athletic, the heart rate tends to be slower, and so on and so forth. And but this is actually a very good device, and it will constantly monitor you. And some of our patients will have atrial fibrillation recorded. Otherwise, we will have completely missed it. And they will bring in their recording on their phone or send it to us, and we would be able to check it whether it's true or not, and then treat accordingly.
Would you recommend that everybody at a certain age starts looking at their heart rhythm, or is that a little overkill?
I think it's a little bit overkill. And for people who are very athletic, it's very useful for monitoring their heart rates for exercise purposes. But for people, I think if you have symptoms and not feeling well, or you have palpitation, they're bothering you, and we can't really catch it very easily with the monitor that we normally use, having these watches can be very useful for us to actually find out what their rhythm is like when they're having symptoms.
Okay. We're going to take a quick break, and when we come back, we'll discuss one of the leading causes of pain and physical disability in Canada. That's next.